Pamela Doja, and today I will be performing part one of the health assessment. Good afternoon. How are you doing today, ma'am?
And you?
Do you give me permission to perform a health assessment on you today?
Yes, ma'am.
I'm going to start by checking the upper skin extremities. She has good temperature warm, no openings in the skin, no rashes, good moisture, no skin breakdown. I do see some 1+ edema in the hands. I'm going to also check the lower extremities. She has good pedal pulses, but about 2+ edema in both the extremities, no skin breakdown. Next, I'm going to check the scalp and the head, frontal lobe, occipital, parietal. Scalp is dry, good skin moisture, no breakdown there, little dryness. Next, I'm going to check the muscular of her jaw. Can you clench your teeth tight for me? Symmetrical, open your mouth for me. I'm just going to assess inside the mouth. Can you lift your head up? I'm going to assess the sinuses. No drainage noted, symmetrical. This ends part one of the health assessment. I will be completing part two of the health assessment, and this will be the eyes, the ears. First, I'm going to explain as far as discuss the Snellen test, which will be checking your eyesight. You would actually, for the Snellen test, it will be a chart with big letters, alphabets at the beginning, at the top, and smaller letters at the bottom. You would actually cover one eye. Actually, this is my little cover up. Cover one eye and read from the top of the chart to the bottom, and you would actually continue with the second eye and demonstrate the same thing. The next test that I will be talking about is the Rosenbaum test, and that test you're checking for as far as neurosight, making sure that as far as nearsighted vision, you also will be looking at a card, reading that card to check nearsight. We also have what you call, it's one more test that we have, your peripheral vision test that we will be performing. And that I'll be using a light to check your peripheral vision. We will be assessing your ears as far as your inner ears, checking for any type of drainage, infection, your outer ear. We will also be doing the 6 cardinal test, and I need you to follow the light. No abnormalities detected. Then we will be checking as far as number 5 and number 7. 5 is more of the muscle. I'm going to ask you, first I'm going to check your muscle strength. I'm going to ask you to open your mouth, bite down hard. Checking your jaw strength. I'm going to open for me. Checking for any abnormalities. Then number 7, I'm going to ask you to smile for me, make a frown for me, stick out your tongue for me. That completes part 2 of the health assessment. I will be performing part 3 of the health assessment that will include the mouth, the pharynx, the throat, and the ears. First, I will begin my assessment by assessing the outer ear. Then I will assess the inner ear, looking for any type of drainage, any redness. It should be pink in color. I will perform the Weber test, which includes my fork on top of the head. Can you hear this? The Rhine test. Then I will ask my patient to stand up and we will complete the whisper test by covering one of her ears, and I will whisper a sentence and she would have to repeat it.
It's a sunny day.
Very good. You may sit down. Then I'm going to be assessing the pharynx area, the throat area, checking for gag reflex. Can you open your mouth? Can you swallow for me? No abnormalities there. I'm going to be checking as far as the color inside her mouth. Open. No problems with the tongue. Checking her lips. I'm going to assess also for any, for her carotid arteries. For the pharyngeal. Are you ticklish? I'm going to assess her spinal strength. And you can push back against me. Turn your head to the right. Turn your head to the left. And that ends my health assessment.